Hi, YouTube. This is Christian Brindle, Medicare Health Plan expert and specialist, and today I'm going to walk you through how to use a website called WellRx.com to get free prescription drug coupons that might be able to save you some money on your prescriptions. Now, it's important to mention with these kind of programs, this is very similar to like a Simple Care program where they give free prescription drug coupons that you can use at the pharmacy, or a GoodRx, probably even more mainstream than that, that typically these kind of programs, especially when you're on Medicare, they're not designed to be used with your Medicare Part D drug coverage. They're more used as an alternative instead. So like sometimes if you're on a very expensive prescription that might not be covered very well by Medicare or your Medicare Part D drug plan, sometimes one of these programs or these coupons can give you a lower price than what the insurance can give it to you at. And so sometimes that's a nice thing. Or maybe you're on a prescription that's not covered by your insurance, and this is a nice alternative, something to fall back on. So just a couple scenarios that you could use something like this. This is just a nice alternative to a GoodRx. So sometimes it's nice to check a couple of different options because sometimes different programs will have different savings on certain prescriptions, and GoodRx might be better on certain medications, but this program with WellRx might be better on others. So this is kind of how it works. It's going to have this search bar right here where you can type in your zip code. You can always type in a medication as well. I'm going to put in the zip code here at our office here in Utah, which is actually in Sandy, Utah. And I'm going to put in a medication. We'll start with a very inexpensive medication. We'll use a one that's commonly seen called Lisinopril. And we're going to search and find the lowest price. Now, typically these kind of plans are going to be able to let you pick based on pharmacy. Certain pharmacies are going to be cheaper than others. So as you can see, Smith's, which is a Kroger-owned pharmacy, for those of you who don't live in this part of the country, that's probably our cheapest option. It would give it to us for $6.48 with this free coupon at the pharmacy. Walmart would be a little more. It'd be $8. Harmon's would be a little more than that. There's a Dan's drugstore, Macy's, Fresh Market, which is an off-chain of Albertsons, Jolly's, and it just kind of goes on from there. Now, to get an idea of exactly how much a prescription like this would cost, let's say if you had zero insurance whatsoever, we're going to check it out and look it up. So the average cost for Lisinopril would be $14.79 a month, typically. That's if someone had no insurance. So it's not like it's doing a ton for you, but it's more than cutting it in half. Now, this is typically a pretty cheap prescription anyway, and you'll find that most insurance companies will cover it probably better than this, so this probably isn't the best example that we can use. So we'll use another prescription here in a second. Let's search for possibly omeprazole, which is another very cheap prescription. But I'm curious to kind of see what it comes out at. So same thing. Looks like Smith's is going to be a recurring factor here. It'd give it to us for $4.68 a month. And then it just kind of goes up from there. If I wanted to maybe search for a higher cost medication, now sometimes the higher cost medications are not always going to be as much of a savings as you might like. So I'll use an inhaler, for example. Like maybe we want to do an Advair Discus inhaler. So even still, that with the discount, that brings it down to about $140 for a 30-day supply. Now, to give you an idea of how much an Advair Discus inhaler costs, okay, so this gives us an idea right here. Right here, it looks like you're paying $5.68 per unit. The average quantity is a lot of times 60, so it's normally 340. So it's actually doing a pretty good job there, but I bet the insurance would do a better job. This is just a nice alternative that we can essentially check on to see if there's any savings for prescriptions. Now, just keep in mind and understand that these programs are what they are. They're not going to be dramatically impressive a lot of times, especially on the free version, but it is a nice alternative to where sometimes you can find certain prescriptions cheaper than maybe you might be able to get them through your insurance. And then if for people that have no insurance, a program like this, a program like Simple Care, which we've done a video on, a program like GoodRx, which we've done a video on, are very, very good alternatives to use, and they're free. They're accepted at most pharmacies. Anyway, folks, I hope you enjoyed this video. If you found this helpful, please do me a favor. Drop a like in the video so I can find more people like you that might need this information very desperately. And also make sure to drop a comment on videos you'd like to see going forward that might be helpful. And make sure to hit the subscribe button so you don't miss any insurance and Medicare information. And we'll see you next time. Thanks so much for watching.